Okay, today we'll be looking at vision health. And we'll be mainly focusing on glaucoma and cataract, these two eye diseases. Okay, so let us break it down one by one. The first question, what is cataract? Okay, over at the front part of our eyes, there's this structure which we call lens. And if you look at the picture, it shows that a healthy eye lens has lenses that are very clear and transparent. And it should be clear and transparent. However, if you look at the right picture, you'll see that the lens look kind of cloudy and hazy. And that means that cataract is already occurring because your lenses have become cloudy and hazy. So why did they become cloudy? This occurs when the protein in your eyes, or perhaps the fiber in there, they're like starting to break down, and those would accumulate over at our lenses. In the long run, when it becomes more severe, your vision would become blurry and cloudy, and at night your eyes would look like as if there's like astigmatism, as how shown in the left picture right here. And the contrast of your eyes would also become a problem, and your vision would not be clear anymore, and you wouldn't be able to focus. So how should you know whether you have cataract? What are the symptoms? Actually, the development of cataract comes unknowingly. You won't feel anything or like any pain. So if you guys realize that when you're looking at stuff, maybe when you look at lights, it would be really piercing or it would look too bright. And maybe some might see double vision, like you'll see two of everything when you look at things. And at night, you will be unable to see things clearly. And the colors will look like as if they're faded, and all these are the possible symptoms of having cataract. So why is it like this? Well, our lenses are in charge of allowing our eyes to be able to concentrate on light rays and to concentrate all the way into our retina at the back. And if it concentrates on it nicely, the image would look clear. But if you have some white and cloudy stuff that obstructs it, it would affect the condition I mentioned earlier. As for cataract, if you want to ask if there are any ways to reduce it, usually after it forms, you do have ways to reduce the turbid substance. And in terms of medications and medical treatment, when cataract has strongly affected your daily routine, let's say while driving, reading, watching TV, or maybe you're unable to do your daily routine any longer, you can only rely on surgery for treatment. Maybe by inserting an artificial lens through surgery. And I won't be able to go into details for everyone as I'm not a doctor, and I can only tell you that this can only be resolved through surgery. All right, then you might ask, why do cataract occur? What factors causes it that would make me have cataract in the future? Is it passed down by family, among family? Actually, cataract mainly has to do with increasing age. As mentioned earlier, it's because the protein and fiber in our lenses have broken down and is accumulated over at our lenses, which leads to this problem. So why would the protein and fiber break down? This is mainly because our eyes over at this area has been affected by external things or is injured, or maybe it's because you're older and you have been exposed to many things that could damage your eyes. For instance, you're often exposed to sunlight. Sunlight is one of them because sunlight has UV rays, and UV rays will lead to oxidization, which would affect the health of our eyes. And another thing is if you had injured your eyes before, or maybe you've undergone certain eye surgery, all these would increase the risk of us getting cataract. Another thing is, let's say your body has some long-term health condition, especially diabetes. Diabetes would affect our blood circulation, and because our eyes have many blood vessels too, so it would affect our eyes in terms of the transmission of oxygen and nutrients. All these would affect the cells in our eyes and its health state. Another situation is if you consume medications long-term, those that contain steroid, and it's not just the ones for consumption. It might be the ones that are not suggested by doctors and you went to get them yourself, such as eye drops. And these might have steroids in them too, but you just don't realize it. And after using it for a long time, it would also lead to these problems. So if there are any discomforts, prevent from getting medications for consumption or application yourself. It's best if you can confirm with the doctor to see the cause of the problem and listen to the doctor's suggestion for which medications to purchase. Okay, the second question is glaucoma. What is glaucoma? Glaucoma is not that your eyes are green, because in Mandarin it's directly translated to green light eyes. So that's not what it means, okay? Actually, for glaucoma, it is similar to cataract in ways that there are not much symptoms when it develops. You won't feel any pain. Another thing that is similar is that both glaucoma and cataract would affect our vision. They would both affect our eyesight. As for glaucoma, if we don't treat it ASAP and delay its degeneration, or if we don't treat this gradual vision loss, we might actually end up blind if we don't treat it in time. So we might lose our eyesight. Okay, studies also found that if you have glaucoma, it would also affect our lifestyle as well, as it would make it difficult to do our daily things, and it's difficult for us to do it by ourselves. And it might be hard to not rely on others, especially for elderlies, as they might be unable to walk by themselves because they can't see. So they will get hurt easily and might have traffic accidents more easily, especially among elderlies. So these are all the findings of those who have glaucoma. And in the future, there might be some problems due to the affected vision as well. So what is glaucoma? It is what I've mentioned earlier. It is an eye disease that has no symptoms and doesn't hurt. We also call it as a type of abnormal chronic eye disease, which is that you might not be able to realize it, but it is happening. And actually, it takes a pretty long time to occur, and it occurs bit by bit too. So if you don't do eye checkups regularly, you will not be able to realize that your vision is depleting. Okay, it's not about nearsightedness or farsightedness. This is when your eyesight range is becoming smaller. And since it is occurring slowly, you wouldn't realize the changes. Glaucoma is actually a type of vision degeneration that you are unable to rescue. Earlier for the cataract, you can still go for surgery and change up your lens, right? But actually for glaucoma, there's no way to completely treat it. There really isn't a way to help you to recover completely. As for glaucoma, of course, it also has to do with cells oxidizing and ruining the cells in our eyes. One factor that we can control is blood pressure, which is the eye pressure in our eyes, the blood pressure in our eyes. Basically, our eye pressure, our eyes have pressure. So if the pressure in our eyes is too high, it will lead to glaucoma in the long run. And as how I mentioned earlier, if we don't treat it in time, we might actually completely lose our eyesight. So how does it occur? Actually, in our eyes, there are fluid, and these fluid, especially the ones over at the front part area, if they're unable to have balance in terms of its aqueous humor formation, there might be the problem of drainage. the liquid is supposed to have a normal circulation. But if the liquid can't circulate, it means that something is wrong, and it may accumulate in the front part of the eye, and it might cause compression. So in the long run, it might cause compression at the back of our eyes too, slowly wearing away the nerve cells required for vision. And our optic nerve, which is the nerve at the back, they would deliver the images you see to your brain and allows your brain to analyze what you're seeing. If you often push against your eyes, this will lead to nerve damage for your optic nerve. And in return, it would affect your vision. So let us take a look at the next picture. What is glaucoma? If you're in the early stages, your vision might start having some black stuff, and you'll see that you can't really see that clearly anymore. It doesn't just happen on the sides. It might also occur in the middle. It can occur anywhere. And as it gets more severe, your eyesight range will start to become smaller and smaller. Earlier, I mentioned that we need to treat it right, but actually for this treatment, it doesn't really help to completely resolve the glaucoma. Its main treatment isn't to help you recover your eyesight, but to reduce your eye pressure or to prevent it from degenerating even more. And it helps you to soothe the severeness, but it has no way to help you recover from your previous injuries. Your cells are never coming back, especially when you damaged your optic nerve. And for that, normally, the doctors would give you some sort of eye drops or have you do some laser surgery and some other surgery that would help you to reduce your eye pressure. So what is the lesson I want to let everyone understand today? Okay, don't wait till your eyes are damaged. Only you start looking for solutions and treatments. Oftentimes, you wouldn't really have a good solution to help you recover completely, and you can only reduce its severeness. And glaucoma is the best example. After having a better understanding of the above condition, let us look at how we can take good care of our eyes through dietary intake. What should we be doing since young? Okay, first of all, we should eat more vibrantly colored produce, especially different colored fruits, veggies, and whole grains. What are whole grains? Whole grains are not the ones that have been processed and have their skin removed. Whole grains are like brown rice, oats, and even corn. All these are types of whole grains. Actually, veggies and whole grains are considered to have lower GI. They're considered to be low GI foods. When you consume it, it wouldn't cause sudden spike in blood sugar as compared to the other processed foods that might contain sugar. And it can also allow a more stabilized blood glucose. Earlier, we mentioned that diabetes would also affect our eyes. Okay, this is the first reason. The second reason is that when we see fruits and veggies that are rich in colors, we would know that it contains many types of antioxidants. And antioxidants are there to prevent our cells from getting damaged by free radicals. For instance, as for UV rays, if you're exposed to these polluted substances, it will cause the free radicals in our body to harm our cells. And it is the same for our eyes. Therefore, we need to intake colorful fruits and veggies in order to get its antioxidants to protect our eyes. And there are many types of nutrients for antioxidants, such as vitamin A, vitamin C, vitamin E. These are a few that studies have found to be beneficial for our eyes. Okay, vitamin A can be found in darker leafy veggies and those in orange colors such as oranges and veggies such as carrots, sweet potatoes, and papaya, and some red ones such as grapefruits and red bell pepper. All these are rich in vitamin A. And as for vitamin C, everyone knows it's a great antioxidant, right? Actually, studies also found that those who eat a lot of vitamin A and vitamin C tend to have a lower risk of having glaucoma. So if you're worried that you might be in high risk of getting it, you can consume these kind of foods. Another thing is we don't call it as nutrients, and it's not a type of vitamins as well. It's not vitamins, but it's an antioxidant that our body needs. There are many types of antioxidants, and it can be vitamins, it can be minerals, it can be others, such as lutein and zeaxanthin. Where can we find these, like the lutein and zeaxanthin? So for that, we can find them in orange-colored fruits, and veggies and green fruits and veggies such as spinach, lettuce, broccoli. And for orange, it could be pumpkin or yellow like corn. All these contains lutein and zeaxanthin, and they are the antioxidants that our body needs, that our eyes need. As for whole grains also contains a type of nutrients that is very crucial to our eyes, which is vitamin B1. Studies also found that this can decrease the risk of getting glaucoma. They also found that those with a high vitamin B1 diet has a lower risk of getting cataract or just having any vision problems in general. So whole grains can help us in this aspect. And besides whole grains, beans, nuts, and seeds also contains a lot of vitamin B1. Finally is omega-3. Everyone knows that omega-3 is good for our blood vessels, and blood vessels have to do with our blood pressure, right? So it can also help those with glaucoma and help reduce their eye pressure. Earlier, we also saw that it has anti-inflammatory effects, which is important for our body. Other than that, besides the antioxidants and anti-inflammatory effects, there's another mineral, which is magnesium. Studies also found that magnesium is also good in treating glaucoma, as magnesium can promote our eyes' blood circulation. Actually, magnesium allows our body to relax, so it is great for our blood vessels. At the same time, it also has antioxidant effects. It is a mineral, but it is also an antioxidant, so it can actually reduce oxidation. And with that, it can reduce the cells in our eyes from damaging. Earlier, we mentioned what we should eat, right? Then comes another question. How is caffeine related to our vision health? So caffeine can be found in mainly 3 things that we often eat or drink. The first one is coffee. Everyone knows, right? So second is tea, and third is chocolate. Actually, chocolate contains caffeine, and according to studies, doctors would recommend those who are diagnosed with glaucoma to control their intake of caffeine. Why? This is because caffeine would affect the blood flow in our eyes, and it would restrict blood flow into our eyes. It would also affect eye pressure, as it increases eye pressure. And studies found that after drinking a cup of coffee, your eye pressure can last up to 90 minutes. Though it is temporary, it can increase it. Usually, clinical studies will recommend those with glaucoma to not drink coffee before doing eye checkups. And on other days, you should cut down in the amount of coffee you drink and only just around 1 to 2 cups a day. Studies found that if you drink up to 4 to 5 cups a day, the risk of you getting the diseases would increase. I believe that no one here today drinks 4 to 5 cups a day, right? Perhaps at most 1 to 2 cups a day. And if you're allergic to coffee, it's best if you don't drink it, because not only will your heart beat faster, your eyes might be affected as well. Okay, the suggestion mentioned earlier is if you have glaucoma. Then you might ask, what about tea? Yes, tea do contain caffeine, but it's not a big difference as compared to a cup of coffee. 1 cup of coffee contains around 125 milligrams. So the advice to only drink 1 to 2 cups of coffee means your caffeine intake can't surpass 250 milligrams. And tea actually contains very little caffeine, and 1 cup of tea contains less than 50 milligrams. So there really isn't a recommended dosage, as it contains very little. Besides being low in caffeine, it is also different than coffee as it is rich in flavonoids. Flavonoids is actually a type of polyphenols, and it is also a type of antioxidants. And there are truly many different types of antioxidants. And as for flavonoids, besides helping us to fight oxidation, it can also promote blood circulation. So a cross-sectional report from the National Health and Nutrition Examination Survey stated that people who consume at least 1 cup of hot tea daily are less likely to have glaucoma as compared to non-tea drinkers. And this benefit can be found on those who drink coffee. Coffee also contains polyphenols, but there are no significant association between coffee and glaucoma risk in this study. So this is the difference between coffee and tea. As for vision health, there's also dark chocolate. The dark chocolate is the one that's on the right side. It's not like milk chocolate or like white chocolate. It's not those, but it's dark chocolate. Because dark chocolate contains the highest and purest cocoa powder, and you need to ensure that you're buying real chocolate, not the ones that has been processed with palm oil. Those aren't healthy chocolate anymore, and what you need is real dark chocolate. It's best if the dark chocolate is higher than 75%, and yes, it also includes caffeine, flavonoids, and a lot of polyphenols. And as it contains many polyphenols, dark chocolate is beneficial for certain cardiovascular conditions. And it can also decrease the damage from free radicals as it has antioxidant effects. So if you're worried of having glaucoma, or if you need antioxidants, at the same time you like eating chocolate, you can consider dark chocolate. This is why caffeine is related to vision health. So you guys need to know what food is good for your eyes, and you need to adjust certain food intake, such as coffee if you have glaucoma. And so you need to learn how to control. And last question, why do we say that gummy Vizio is beneficial for our eyes? After a long talk earlier, could it be that gummy Vizio contains all that I mentioned earlier? Actually, that's not it. First, let us understand what gummy Vizio contains. Gummy Vizio contains the active components we mentioned earlier, which are lutein and zeaxanthin. The ratio is greatly paid attention to in gummy Vizio, which is that it has a 5-to-1 ratio. 5 milligrams of lutein and 1 milligram of zeaxanthin. Why is it that way? This is because the U.S. National Eye Institute recommended this ratio, as this 5-to-1 ratio is beneficial to our vision. Okay, where are the extractions from? Earlier I mentioned that these are antioxidants from plants, right? colorful dark green and orange colored plants. So in gummy Visio, the lutein and zeaxanthin are extracted from marigold flowers as it is rich in lutein and zeaxanthin. It also uses a unique purification process. Earlier, I also mentioned that there are many types of antioxidants, right? So why do we pick lutein and zeaxanthin for gummy Visio? Okay, this is because among all the other antioxidants, lutein and zeaxanthin are the important building blocks for our retina, and our body needs lutein and zeaxanthin to form the macula. In order to form the macula, that is the center of our retina. And this is why they are different from others. Because besides it being an antioxidant, it also helps to form an important part of our eyes. So this part is the center of our retina. And if we have high levels of lutein and zeaxanthin over here, then it would form like a built-in sunglasses to help us filter the harmful rays. And besides UV rays, harmful rays includes the blue light from your screen, your phone and laptops. All visible light contains blue light, and blue light is the light that causes our cells to oxidize. And since it has a really high energy wavelength, it can cause these kind of damage. So with this lutein and zeaxanthin, they'll be able to help you and act as a sunglasses to filter the harmful blue light, and to help you prevent by having a layer of protection from getting damaged by blue light. Therefore, besides filtering blue light, gummy Visio also helps to protect your eyes from other harmful rays, which includes UV rays. Besides that, it is also a very strong antioxidant, and it can help to reduce or synthesize free radicals. When free radicals are synthesized, it would go and attack, oxidize, and ruin our cells. And over here, it will be our eye cells. And after it synthesizes the free radicals, it can actually protect the cells in your eyes from oxidizing and damaging. And when your eyes are damaged, you wouldn't have the problem of eye inflammation. Inflammation occurs when it is damaged. For instance, even after getting in control, it would still get inflamed. And therefore, with that, it can protect our cells from damaging and reduce the chances of getting eye inflammation. Okay, lastly, it can rebuild the density of macular pigment that is in the center of our retina. Studies also found that the higher pigmentation of our macula, the risk of getting macular degeneration due to old age would decrease. And macular degeneration is when the center of our retina is sick, and it would damage our vision as well. This is different from glaucoma and cataract, but all would damage our eyesight and sometimes even lead to blindness. To conclude, lutein and zeaxanthin are both strong antioxidants that can protect and prevent us from getting chronic eye diseases. It is a foundation, a basic building block that we need. And lastly, we only talked about this glaucoma and cataract issue. But in fact, there are many other structures of our eyes that we need to protect as well. Earlier, we also mentioned several nutrients. Besides replenishing gummy Visios, studies also found that vitamin A, carotene, vitamin C, vitamin E, magnesium, and even zinc. All these can prevent our eyes from getting chronic eye diseases. So besides gummy Visio, you can also cooperate it with gummy C. And depending on yourself and your own diet, like whether you're able to get these important nutrients like omega-3 or other antioxidants, you can also add on to an appropriate amount of spirulina and EPA, DHA to supplement the things you aren't able to get through food. All right, that's it for my sharing today. Thank you, everyone, and see you next time.